Okay, welcome back to the channel Therapeutic Guidelines by Kurat Atif. Now, today I have an exciting news for all of you. I'll be recording the latest version of the Therapeutic Guidelines from today, that is version 4. And in today's episode, we will be covering the writing prescription chapter, which is dental prescription and prescription writing from the latest version of the TG. Now, this chapter is important because it shows us the correct way to write safe and legal prescription. It has some updated diagrams and examples, and it also highlights key points to remember when prescribing compounded medicine. And it also has the new advice on medicine supply by the dentist. So let's start. Principle of safe prescribing for dentist. So the information included in this topic is appropriate for dental practice and may not be applicable to other areas of medicine. For legislation pertaining to obtaining, possessing, prescribing, selling, supplying, or administering medicine in each of the states and territories. There's a link, you can click on that. Now, dentists should follow the appropriate legislation for their state or territory because it defines their rights and responsibilities regarding prescribing in their state. Prescribing rights are specific to an individual practitioner and cannot be delegated or shared. Safe and competent prescribing requires dentists to know when and when not to prescribe. Dentists may prescribe prescription-only drugs and drugs available over the counter, provided the drug is for the dental treatment of a patient under their care and the prescription complies with the relevant state or territory legal requirements. Dentists should not prescribe drugs to treat conditions outside their scope of practice. Even if a condition arises as a result of another drug the dentist prescribed. Prescription must be written for use by the person named on the prescription. A prescription must not be written for a specific patient to obtain stock for use in the practice on multiple patients. They have repeated again in the box that a prescription must not be written for a specific patient to obtain stock for use in the practice on multiple patients. Dentists may not order repeat prescription on the Pharmaceutical Benefit Scheme, which is PBS. State and territory legislation regulates repeat prescription of non-PBS items by dentists. Now, legislation about prescribing for staff, family, or friends, or for the purpose of self-administration, they varies between individual state and territories. However, self-prescribing and prescribing for staff, family, or friend is generally not recommended. So there is something new I can see from the previous TG to this, that they have now said that it is not recommended. Expectation for how prescriber will undertake judicious, appropriate, safe, and effective prescribing are outlined in the Australian National Prescribing Competencies Framework. An approach to good prescribing is summarized in 10 Principles of Good Prescribing, a printable poster from the British Pharmaceutical Society. There must be something, maybe you can Google, you'll find something. 10 Principles of Good Prescribing. Requirement for safe and competent prescribing include reviewing the patient's medical and medication history and screening for potential adverse drug reactions and drug interactions. So before prescribing any medication, it is really important that we know the medical history of the patient, what medications they are already taking, the screening for potential adverse drug reactions, and if there is any drug interactions. Okay. Now, consideration when prescribing drugs of dependence in dental practice. Drug of dependence includes some Schedule IV drugs, for example, most benzodiazepine, and all Schedule A drugs, which are called as controlled drugs, as outlined in the relevant state and territory legislation. Dentists should be aware of the relevant legislation for their state or territory that regulates their rights to prescribe drugs of dependence and how to write the prescriptions. Additional consideration apply when prescribing drug of dependence. In most states and territories, dentists can prescribe a drug of dependence for a patient under their care provided all the following points are fulfilled. So what are the points? They do so in accordance with legal requirements. They have taken all reasonable steps to ascertain the identity of that person. They have ensured that a therapeutic need exists. The drug is required for dental treatment. Non-medical use that does not align with the directed use of drug of dependence, particularly opioid, is increasingly prevalent. The addiction guidelines include this as a disorder of substance use. The most severe form is substance dependence. If a patient requests drug of dependence, particularly if they exhibit a good level of knowledge or preference for a specific drug, consider that they may have a disorder of substance use. So for more advice, see psychiatric disorder and disorder of substance use, dental consideration. There's a link on that. Contact police as well as state or territory health department for advice on reporting lost or stolen prescription pads, which could be used to fraudulently obtain drug of dependence. Some state or territories have online notification systems. So if you find out that your prescription pads are lost or they have been stolen, then you have to report to the police. So there is something else new they have added in TG. When prescribing drugs of dependence to any patient, check the state and territory-based real-time prescription monitoring system. It is a mandatory requirement in some states. These systems monitor prescribing and dispensing of drugs of dependence and provide alerts in high-risk situations. For example, prescription from multiple providers, high-risk combination of drugs, or when the opioid dose threshold has been exceeded. For contact details of real-time prescription monitoring systems, they have given again their link in the addiction guidelines. You can see if you are really want to know. Okay, now the legislative acts and regulations relevant to prescription and prescribing, they have given different states and what are the acts in different states. This is not important for exam point of view. The next topic is cost of medicine prescribed by dentist. So the Pharmaceutical Benefits Scheme, which is PBS, subsidizes certain medicine prescribed by dentist. We can find it on PBS website that what are those certain medications which are prescribed by the dentist and the cost will be subsidized. Medicines not listed as dental items by the PBS can be prescribed by dentist, but the patient will have to pay the full cost when the medicine is dispensed. Prescription only non-subsidized medicine can be prescribed as a private non-PBS prescriptions. The role of the dentist in supplying medicines. Now, the role of prescribing and supplying medicines to patients are usually separated to avoid a conflict of interest and promote medication safely. Dentists supplying medicine directly to patients should do so to the same dispensing standard. Note 1. Now we have to find out what is the Note 1. The Pharmacy Board of Australia guidelines define dispensing as the review of a prescription and the preparation, packaging, labeling, record keeping, and transfer of the prescribed medicine, including counseling to a patient, their agent, or another person who is responsible for the administration of the medicine to that patient. So that was note 1, including including labeling, packaging, recording, and patient advice. Now, for a summary of the legal and professional requirement for supply of medicine, we will see table number 13.1, which give us the guidance for the supply of medicine by a dentist to a patient. What we need to do? We need to check that the medicine is suitable for supply. Then we need to check that the medicine contains the exact ingredient and strengths intended. Check that the medicine is within its expiry date, and consider whether the medicine requires reconstitution before supply. Now, label the container in English in accordance with state legislation and appendix of the poison standard, and include the following in the label of the medicine: generic or brand name of the ingredient or drug, strength and form of the ingredient, total quantity in the container, patient's name, name of supplying dentist, practice address and telephone number, date of supply, comprehensive instructions for use, including advice on whether to take the medication with food or how to store the product. Maybe we have to use it, store it in the refrigerator or in the room temperature. Now, safety warning about sedation. These are required by law if the drug is listed in Appendix K of the poison standard. The words "keep out of reach of children" in red on a white background, it should be written there. The word "poison" or "for external use only" in red on a white background if the product is for external use only. And at the end, batch and expiry date on the container must not be obscured by the label. Then recheck safety aspect, educate the patient, and document the supply. Recheck the patient's name, age, and history of allergy and adverse drug reactions before supplying the medicine. Explain the purpose of the medicine, the duration of use, how to use it safely, and what to do if adverse effects occur. Provide a consumer medicine leaflet if available and the patient has not had the product before. Record in the patient's history the medicine given, indication, brand of medicine supplied, dose recommended, quantity given, and advice provided, including whether a consumer medicine leaflet was given. So all these things we have to take care of while prescribing medicine to the patient. Right? Now, medicines supplied by a dentist are not subsidized by the PBS, which is Pharmaceutical Benefit Scheme. And for more information, we can see advice on the cost of medicine prescribed by dentist. It is outside a dentist training and scope of practice to compound medicines for supply to patient. And what are those? You can see in note 2. Now, a dentist can prepare a small amount of a medicine. For example, crush a tablet in water to create a mouth rinse for use during a dental appointment. But it is outside a dentist training and scope of practice to compound a medicine for a patient to use at home. And I think this is very, very important for exam point of view, that a dentist cannot give compound medicine to a patient. Only a crushed tablet in water as a mouth rinse, we can give it to the patient, but otherwise to use at home, no, we can't do that. Dental practice, writing the prescription. A prescription is a legal document written as a communication tool between the prescriber and a pharmacist for preparing and dispensing a drug for a patient. Now, who can write prescription and how they should be written are outlined in the relevant state and territory legislation. And to reduce the potential for error, the prescriber must provide a prescription that is legible, clear, and unambiguous. Although computer-generated prescription can be easier to read than handwritten prescription, errors can still occur. Electronic prescribing, e-prescribing, provides prescription through electronic tokens, for example, in text message or email. It does not refer to printing a computer-generated prescription. Electronic prescribing requires software that conforms with requirement of the Australian Digital Health Agency that provides infrastructure with decision support tools and links to the Pharmaceutical Benefit Scheme and Medicare. So this paragraph which I just read is also new. Essential information required for a legal prescription written by a dentist varies slightly between individual states and territories, but generally comprises the item listed in 13.2. So what is their instruction for writing a prescription in dental practice? Printable figure. Use computer-generated prescription if possible to eliminate the use of handwriting. Handwritten prescriptions should be in the writing of the authorized prescriber only. Prescriptions with more than one handwriting style may be rejected by a pharmacy or suspicion of fraud. For an item on the Pharmaceutical Benefit Scheme, a PBS prescription form may be used, available from Medicare Australia. In addition to the formation specified below, place a tick in the PBS box. Repeat prescription may not be ordered by dentist. Now that was for the printable and PBS one. For an item that is not on the PBS, a PBS form may be used, but all the references to PBS must be crossed out and the form endorsed with the words non-PBS prescription. We will see their figure down below, two different kind of prescription pads, which include a PBS and which include non-PBS. So PBS item and non-PBS item must be written on separate prescriptions. Aim to make the prescription tamper-proof, unalterable. Use indelible ink. If space is unused on the prescription, put a line across the area to prevent fraudulent addition of items. Use plain English. Do not use abbreviation or Latin terms, except for standard recommendation abbreviations. For example, you can use mg for milligram or ml for milliliters, but do not use abbreviate micrograms. Okay? Avoid using decimal points if possible. For example, write quantities less than 1 gram as milligram and quantities less than 1 milligram as microgram. If you are using a decimal point for a quantity less than 1, then you have to put a 0 in front of the point. For example, you can write 0.5, not just 0.5, because otherwise the patient can add 2.5 or 3.5, which will be again not right. Now limit the number of items on a prescription to 3 or limit it to 1 if prescribing a drug of dependence. So if you are prescribing drug of dependence, then only limit 1 item on a single prescription. If you are giving non-drug of dependence, then you can put 3 items on 1 prescription. Now, items to include in the prescription. Prescriber names, address, telephone number and qualification, which will be yours, of course. Prescriber number, then patient full name and their address, date of birth, age and weight specifically for children, date of birth on prescription for drugs of dependence and monitored medicine, date the prescription is written, then drug name in full, prescribing by active ingredient, use of the generic name. It is mandatory for printed or electronic prescription and it is good practice for all prescribers. Then we have to use drug strength, for example, how many milligram, 250 milligram, 500 milligram or 1000 milligram. Then drug form, for example, if it is a form of a tablet or a capsule or a mixture, then drug dose, route of administration and frequency written clearly in plain English. Like it is not appropriate to write take as directed. So you have to write everything clearly. Duration of treatment, for how long they have to take this medication, especially for antibiotic. It is a requirement of the PBS. Then quantity of a drug to be supplied. For a drug of dependence, the prescription must use numbers and letters to specify the quantity. Further instruction necessary for the pharmacist. For off-label use, for example, use of topical corticosteroids inside the mouth, include a comment that the intent use is off-label but appropriate and ask the pharmacist to reassure the patient that it is safe. Okay. Now the word for dental treatment only should be written on the prescription, and handwritten signature of the prescriber should be there. Okay, so now we are going for the example of the format required for a legal prescription written by a dentist, and I will also show example of a prescription for a drug of dependence, which illustrate the additional safety consideration for a drug of dependence, such as the need to include the patient's date of birth, prescribe only for a short duration rather than a full packet, and use numbers and words to indicate the quantity of medications to be supplied. All right, so here we are. So in this figure, example of the format required for a legal prescription written by a dentist for an item on the PBS. So these are those drugs which are like subsidized. Okay. So what we need to do, the prescriber details, which is your detail, doctor's name, their qualification, their address, phone number, and your prescriber number. Okay, then patient's name, patient's Medicare number, patient's name, and patient's address. Then if it is a child, then their date of birth, their age and weight also. Then you have to take, if there's a PBS medication, then take the PBS box. Okay, and then we have to give the generic drug name, strength, and their form. For example, phenoxymethyl penicillin, 50 milligram or milliliter, or what is the form? It is a suspension. Okay, then we have to give the drug dose, the route of administration, frequency, and duration in plain English. Like give 225 milligram, 4.5 ml orally 4 times a day, 6 hourly intervals for 5 days. So it includes everything. The dose of the drug, which is 225, route of administration orally, frequency 4 times a day, and duration 6 hourly. All right. Then we have to write the quantity to be supplied, like 100 ml 3 times. Then you have to, if there is an empty space, you have to put lines across the unused space. And then you have to do your signature, like prescriber signatures and date of prescription. And at the bottom of the page, you have to write for dental treatment only. So this was one example, and this was the second example. Everything is the same. It says the example of the format required for a legal prescription written by a dentist for a drug of dependence. So it is for the drug of dependence, as I mentioned earlier, that if there is a drug of dependence, only one medicine we will write on a prescription. Okay, so that was the example for that one. You can see only one oxycodone, immediate release 5 milligram tablet, take one time every 4 to 6 hours as needed for severe dental pain. 30 tablets, no repeats. So it has mentioned each and everything clearly in plain English. All right. Now, dental practice discussing the prescription with the patient. How you can discuss about the prescription with the patient. When prescribing drugs, provide the patient with specific information about the drug, including the generic or approved name of the drug, the expected therapeutic effect of the drug, and how long it will take to start working. Instruction on how to use the drug, including the dose, route, timing in relation to food, duration, and frequency of use. For example, whether to take the drug regularly or as needed. You also have to tell them potential adverse effect and what to do if they occur. You also have to mention other precaution, for example, possible interactions, maximum dose, and when to return for review, and then advise on who to contact if they need it. If the prescription is for off-label use, make the patient aware of this and inform them of the potential benefit and harms. For more advice on off-label prescribing, there is a link. See advice on off-label prescribing in dental practice. Patients often do not remember the verbal instructions they are given during a consultation, so it is preferable to give both verbal and written instructions. Consumer medicine information, which is CMI leaflets, are available for the majority of medicines prescribed in Australia and should be offered when a drug is prescribed or supplied. The leaflets are available from pharmacies, some clinical software packages, and online, for example, TGA website. For a printable patient information leaflet on use of opioids for acute pain at home, we can see opioid use patient information sheet. All right, so that's the end of today's chapter. And so you always remember that small steps every day, they bring you closer to your goal. And if you are preparing for the ADC exam, do not forget to subscribe and share this channel with your friends and study group, because as you know, it might help them just as much as it helps you. So make sure that you subscribe the channel so you don't miss the next chapters. And together we'll make TG easier, clearer, and stress-free. Your ADC success starts here. I will see you next time with a new chapter. Till then, bye-bye.